Hello, welcome to Innovative Health Podcast. I'm your host, Kristen Willisonovich. Here to my far right, my beautiful guest co-host, Joe McAllister.
You're too kind.
How are you?
Amazo.
You look great today.
Thank you, so do you.
Thank you so much. And in between us is the always ever handsome Dr. Richard Klein. Hello, sir.
Hello.
Good morning.
We're always so excited to have you on Innovative Health Podcast. When you were last on the show, we had talked about your specialty. You are a dentist by trade, correct? How long have
Yes.
you been a dentist?
Oh, a long time. I graduated dental school in 1967, practiced for 20 or 30 years.
Okay.
And then I had a change in my career, and I only do sleep apnea and TMD problems now.
Okay, so TMD is, explain what TMD is for our viewers and listeners.
The lower jaw is called the mandible.
Okay.
The mandible hinges in a joint right here. If there's a problem with this joint, which is close to the temple, they call it TMJ, temple mandibular joint disorder. So TMD is a disorder of this joint.
So we all have TMJ, but we all don't have the disorder, thank goodness.
Most people don't have the disorder, and that's what I treat when that exists.
So you oversee Michigan Head and Neck, correct? How long have you had Michigan Head and Neck?
I formed Michigan Head and Neck Institute in 1985, so it's been a while.
Okay, it has been a while. And you've really changed some lives, haven't you?
I'm so happy about that. I thank God for the accident that changed my career, which precluded me from being a dentist working upside down like a bat looking into your mouth.
Well, tell us a little bit how that transpired, how the trajectory of your career path and really your life changed in an instant, really.
Yes, I was on my way to lecture to the Brain Injury Association about what happens in a car accident many years ago. And I was rear-ended, pushed into the car in front of me, and my Kodak slides went all over the place in the car. And I herniated cervical and lumbar discs. I've had 2 total knee surgeries, and I had a TMJ problem. Couldn't practice dentistry, so I went and learned how to fix it.
Oh, wow. It's very interesting. So today you're here to talk to Joe and I about 2 different items on the agenda. And the first is sleep apnea.
Obstructive sleep apnea is when your muscles and your soft tissue collapse while you're sleeping. Now, I think all people know they've seen a little baby. They pick the baby up and the baby kind of wakes up and giggles or stays asleep like a rag doll. Now, when that happens, that little baby is in deep REM sleep, rapid
Yes,
eye movement.
that's right.
The old rock group REM, I'm not sure if that's
Yes,
why
yes,
they
yes.
named, but yeah.
Yes.
So during REM sleep, the brain paralyzes the body so that it gets a little tune-up. Freud, who was the guru of dreams,
Right.
thought it paralyzes your body so you don't act out your dreams and hurt yourself.
Oh my goodness.
Well, he was right on the right track, but that's not the real reason. So what happens when these muscles all relax, with certain people and certain anatomy, the muscles collapse and completely control the ability of you to disappear. You can't breathe. It's like taking a hose. Remember when you were a kid, you had to move the sprinkler? You would crimp the hose.
Oh, yeah,
Sure.
to
And
stop
and the water wouldn't go through.
And then make
Those
the water
were-
spray on your friend
That's
or your
some old
sibling.
school days, yeah.
We all knew that old school stuff. So what happens if this collapses on itself, then the water can't get through the hose or the air can't get through here.
Wow, that makes a lot of sense.
Even just as important, right now you and I are breathing in and out. Everybody listening to this is awake and breathing in and out. So if you breathe in oxygen, but then can't exhale it, carbon dioxide is very acidic, and that stays in your body. So if you're not breathing for 10 seconds or 30 seconds, you're not getting new oxygen, and you're not exhaling the carbon dioxide, both of which then slowly cause every cell in your body that needs oxygen to deteriorate.
Oh my goodness.
And people die from strokes, from heart attacks, but they've
I
more
had no
recently
idea.
found out it causes type 2 diabetes, ADD, irritable bowel syndrome. Why? Every cell gets unhealthy.
Wow.
I did not know it was that serious.
So my question to you is there a certain age when you start to see it more as we age, or is it really non-discriminatory? It happens across the board.
Yes and no and both.
Okay. Yes to all of the above.
answer.
You can be a skinny little tiny baby girl and have it. But the majority statistically that have sleep apnea are older, obese men.
Okay.
Now, why men? In the tooth diagnosis I treat, it's 80-20, but reversed. 80% of men that have sleep apnea, it's 80% men, 20% women. Not 80% of the people in the world, but of those who have the problem, it's 80% men. On the other part of what I treat, the only other one, TMD, it's 80% women.
Wow.
Just
That
a coincidence.
is
Just a
interesting.
coincidence. But the reason is twofold. One, they did a study at the University of Michigan a few years ago that show women feel more pain than men and take care of themselves better. So if you feel more pain, you're going to go to the doctor and get it treated. So
Right.
That's
Yes.
probably why.
Right.
Because anatomy is anatomy.
Right.
We both have the jaws. So why would it be more women? Because you take care of yourselves better. And my gut feeling is that's why women live longer than men.
Yes. Well, we're
With-
smarter too. I'm
Or
just
men
kidding.
who are married, right?
I'm just kidding.
Men who are married
Well, they-
live longer as well.
They say that because their
Yes.
women are making them go to their annual doctor's appointments or making them take care of
Holding them
themselves.
accountable.
100%. Yes.
There's a lot more, but you are right.
Yes, yes.
You're right. Most of the patients that are men, and my wife told me to come.
Yes.
Now,
Why are
the,
you
the
here?
other 80%, this is why they found this out recently, too. Generally, men are taller than women. So if the airway is the same volume for men and women, but the man is taller, the airway is thinner.
Oh, wow.
And it's easier to collapse if it's not as wide.
That makes sense.
I use my hands and
Wow.
I'm talking
Violent.
into this microphone.
It's violent.
Yeah.
That client's
So
violent.
it's just a coincidence, but it's 80-20 or 20-80.
So, how are you treating it? Now, when I think sleep apnea, I'm thinking they have to wear a big apparatus at night and it's heavy and it's constraining. But my understanding, you go a different route.
Yes, the first treatment for sleep apnea before they knew much about it was a trach. They'd open it up so
Oh, wow.
it save your life to breathe. Now, sleep apnea has been around for centuries. We've just recently started to understand it. There was a book written by Charles Dickens called The Posthumous Papers of the Pickwick Club, in which he described an obese young man standing in front of his boss snoring while he was standing up. So they recognized the signs and symptoms. They had no idea what it was. About 100 years later, William Osler is a neurologist, and he was knighted by the Queen. He recognized that people, there's something wrong when they sleep and they get tired and they can't breathe, and he called it the Pickwickian syndrome because he was from England.
Okay, yes.
Yeah.
That's right.
So nothing happened until more recently. The first polysomnography, that's the test that the people go through to find out what the problem was recently, in the 1970s. But they still didn't know what to do with it. Then, instead of the trach, they came out with this mask. Now, what the mask does, it's called a CPAP,
Yes.
continuous positive air pressure, CPAP.
CPAP, yes. So that's what I'm thinking
That's
of.
the mask
Yes.
that looks like you're going to go walk on the moon.
Yes.
Now, it works, but 2 out of 3 people in the world won't wear it.
Right.
It blows air in. So as you're collapsing, it just blows up like a balloon. Let's pretend this is a balloon and it's collapsing, and it keeps blowing it up. It doesn't
and
collapse.
they probably feel sometimes claustrophobic or overwhelmed by it all,
Or they
so
can't
they don't
sleep
want to wear.
comfortably. I
That's
don't
right.
think I'd be able to sleep.
A lot of people, and then if you toss and turn, it comes off, and it leaks and blows air in your eye. So they work wonderfully for some people, and about a third of people say, "I love it." 2/3 of the people say, "I ain't wearing this thing."
Right.
So later, they found out that an oral appliance that brings your jaw forward and prevents it from falling back works just as well for mild, moderate, but not as well for severe, because you can't bring the jaw that far forward if
Sure.
it's really severe.
Sure.
So that's what I do. I get patients that say, "I can't wear their CPAP," and I work with their sleep physician and make a mouthpiece. The mouthpiece they put in just at night, brings the jaw flow forward. So I tell their wife, "You're going to think you're sleeping with Jay Leno." The jaw comes forward and it prevents it from falling back. And most people are a lot more comfortable with that.
Right. Right.
Also, you could take it with you on an airplane without the big case.
Sure.
If you're a hunter, you need electricity. So if you have a CPAP machine, it doesn't work where there's no electricity. There's a lot of reasons.
It's easy to travel with.
So my question too is, once they start receiving the treatment with the new apparatus, do they instantly start to see results? Do they start to breathe better? And how does that also catapult them in their everyday life? What does that change for them?
Well, that's a whole bunch of questions.
I
there.
know.
Yes.
I get excited.
So basically what happens when you're not breathing, you're tired.
Right.
There's something called the Epworth Sleepiness Scale. There's a different one. There's a Berlin and the Stop Bang. But what those are just a screening tool. Are you tired during the day a lot? Are you tired when you're driving a car, when you're watching TV? You're not supposed to be. So you look at that, and if you're tired a lot in different situations, that means you're probably not exercising as much as you want to or should.
Okay.
And let's just say burning 10 calories a day just because you walk a little bit more.
Sure.
That's nothing.
That is nothing.
Yes, it is. Over a year, it's a lot. So if you add that up,
So small doses, yes, like
Yes.
introducing
So
it.
people who are just a little bit tired and don't want to take that little extra walk, they become obese slowly. And that complicates it. As you get obese, men and women gain weight. Men in their bellies, women in their hips, both of us in our throat. Mm-hmm. And then again, as we age, to answer your question, the muscles lose their tonicity.
Yes.
Now, I was lecturing in Scottsdale last year when there was a female sleep specialist, and she said it so much more understandably. Instead of, I was saying for years, our throat muscles lose their tonicity and they collapse easier. Mm-hmm. She said, as we age, everything sags.
That's the truth.
Yeah.
That's the
so
truth.
there's a lot
Need
of
a
reasons
different
for it.
doctor for that.
Yeah, Dr. Klein, we'll refer you. Dr. Klein will refer you. So, okay, very interesting. And it is incredible, I think, too, with lifestyles, because you are starting to see, especially among our youth, right? Like, we grew up living outside. We didn't come inside until the streetlights came on, and we weren't afraid to be outside, and we played and we rode our bikes. And you are seeing less and less of that, especially with the paradigm shift of technology. And then you're seeing these kids just on their phones, and you're probably starting to see more of an arch in their back and their necks and a skeletal difference. It's really
Even child obesity.
well, that's it too. And now they're just eating and they're consuming more, and they're so you're probably seeing it across the board. And I think you're going to start to see you have to practice for the rest of your life, is what I'm trying to say. You can never retire, because I think you're going to see the shift from even an older demographic to a younger demographic suffering from head and neck pain and injury. And I'm sure you're probably already seeing it.
Absolutely. And you're right. I don't want to retire. This is just too much fun.
Well, never. You can't.
Yeah, well, when you put me in a coffin, I want to teach.
Right.
But yes, you're absolutely right. When I was young, I had a paper route. How many kids have paper routes?
Right.
Now, And what that meant is I was exercising. Also, what happened, and you brought that up, go outside and play. They're not
Right.
doing that now.
No.
I remember on Saturdays in the summer, about 3 or 4 of us wanted to go swimming. So I lived, and the other guys around me with the paper route, all around Woodward and 6 Mile. So we'd get on our bikes and we'd meet, and we'd drive our bicycles up to 8 Mile, and we'd drive from Woodward and 8 Mile all the way to Jefferson, which is about 20 miles, and go up a mile to 9 Mile in Jefferson. There was this
Swimming
beach.
hole.
There was
Okay,
a
yeah.
beach.
Nice.
It's all apartments now.
Right.
But we thought nothing of that. That was
Nothing.
just fun.
That was nothing.
And
That was
look how
nothing.
much energy we got
Right.
from that, how much we burned off.
I would see pictures. You knew when someone was at someone else's house because their bike was
Bikes.
flat in their yard.
Yes.
Yes.
You knew someone
knew
was
which
over their
house
house.
everybody
So
was hanging at.
it's sad, and we hope we start to see a shift. But unfortunately, technology just keeps coming at us. So it's just the way of the world. So thank you so much for that information on sleep apnea. It's very fascinating. And, if you have it, contact Dr. Klein. We'll provide information on how to get a hold of him. But there's another topic we really wanted to talk about, and that is eyes, right? You treat a number of eye symptoms. So tell us why someone would call Dr. Klein and come talk to you with an eye problem.
Now, when you say I treat eye problems, it's not. I don't do glasses. I'm not looking at
So
your
you're not
vision.
an ophthalmologist, yes.
Correct. But when I treat TMJ problems, that involves a lot of muscle activity in the head and neck. The posture of how the jaws fit together is how the muscles work. Those muscles are from about your bra strap up in the back, the trapezius sternocleidomastoid. These muscles, the muscles here, and little tiny muscles that, here's an example I want to express. I tell this to my patients. You take that old domino game, you stand them all up. You press one over, they all fall down. When this muscle gets really tight, the little ones next to it start to fall down or get tight. There's one that causes dizziness. There's one that causes hearing loss. There's one that causes pain in the ear. But around the eye, there are many muscles, and I used this on the last podcast, but if all of these muscles get tight, specifically each one does one little thing. Move your eye this way, move your eye that way, move your eye up or down. They all do that one at a time. If they all get tight at once, you get blurred vision. But there's a muscle with a big name, sphenomandibularus. The sphenoid bone is a little bone behind your eye. The mandible is the lower jaw. So they named it after what it attaches to. It attaches to the bone behind your eye and to your jaw.
I would never have thought that it would be all attached on
No,
that far.
it's strange.
Wow.
It was only found about 8-9 years ago.
Well, that's what I was going to ask. When did they discover it, and how? Is it during like CT scans or MRIs? Was it during that technology?
It's not in Grey's Anatomy, which is not the TV program. It's a textbook since the 1800s on anatomy.
Right.
And they republish one every 25 years because anatomy hasn't changed. But Dr. Gary Hack and Michelle Dunn in Baltimore were anatomists, and they took the head, and at a different angle they cut into it. So they found a small muscle with a few fibers, not a huge muscle, that attaches here and to the bone behind the eye, and they named it sphenomandibularus. So I called up Dr. Hack, and I made the mistake. I said, that's a funny name for a guy cutting up cadavers. And he says, yeah, I've heard it many times. So I should have realized that.
Right,
But I
Dr.
said, well,
Hack. We get it.
But that explained to me why you could have pain behind your eye. Because when a muscle gets active, it tightens, shortens, and then it relaxes. That's all a muscle can do. Short, relax. So if the muscle's tight, it shortens. The mandible is huge compared to that little bone behind the eye. That bone behind your eye moves, and it hurts. So what I do is I do a little shot of Marcaine, a local anesthetic, right here, and the eye pain goes away.
Wow.
Because it relaxes the muscle.
It's so incredible what you treat.
Yes,
And
give people
it's
relief.
so crazy because I think that anyone who's experiencing, whether it's the headaches or the blurry eyes or the plethora of symptoms, they go to a primary care physician or they think, like a Motrin or an over-the-counter, and there's just so much more involved. And if they went and saw you, Dr. Klein at Michigan Head and Neck, it would you change lives. How do people get to know you? How do they know you exist? It's a lot of referrals. I understand that. And we'll obviously, scream from the mountaintops about you because you're absolutely amazing. But how would someone know to go to a head and neck? Does it get so severe that they can't handle it? Because you can treat really a wide variety of pain.
Sure, and I would think that you just go to you if you have a severe head or neck injury from an accident.
It's
And I wouldn't-
headaches, it's blurry eyes, it's TMD, TMJ, it's sleep apnea. It's a number of symptoms.
I've been lecturing for about 20 years at St. John Hospital to the residents, so the residents that set up in this area don't go back to Maryland or wherever they're from. They know this.
That you exist.
so
Okay,
it's-
I love that.
And,
Yes.
And my website, but a lot of people come because someone else has heard about it. The word is spreading, not about me, but about how to treat this.
That's
it's spreading
right.
all over the world.
That's right.
And a couple things about the eye, too. Lacrimation. Lacrimation is, if you take the little word lacrimal Christi, the tears of Christ, lacrimation involves tears coming out. So why would you have tears coming out from a muscle problem? Remember the guy Darwin? He wrote about evolution, the beagle. He was an investigator of so many more things. He took a photographer and said, I want you to take pictures of 50 children about 5 years old or under crying. And he looked at all of them, and what he found as a common denominator, when those children were crying, the muscles were tight. And it opened up the tear duct. So if these muscles are tight, even if you're happy, it opens up the tear duct, and you have
Wow.
tears coming down even if you're not sad.
And how would you treat that?
Well, if it's a muscle and it's a TMJ problem, then I treat the TMJ, and the ear problems, the eye problems,
They dissipate.
just
They
go
go away.
Yeah.
Wow. That's so, isn't it
It is
fascinating?
amazing.
Joe?
I'm learning so much.
I know, Dr. Klein. It's really, really incredible because a lot of times too, you get runny eyes. You just assume it's a tear duct or just an eye issue when really it's there's so much more. A lot of it is related to the TMD and the TMJ.
And it could be something else, as
Well,
you said, too, sure. But
For sure. But
I knew none of this in dental school. They don't teach it in dental school. So I always tell my patients, I thank God for the accident I was in. I was in a lot of pain for a while, but this is so much more fun helping people this way.
Sure.
A lot more fun, and I'll never want to tell a dentist this, but I get a lot more pats on the back from my patients and thank you letters. I have 12 letters. Thank you. You saved my marriage. It's really nice.
But we
I
still
love
need
it.
our dentists.
Oh yeah.
we do.
Absolutely.
But like Dr. Klein says, he gets much more hugs
Sure.
than giving root canals.
a lot of
They walk out going,
reward.
nah.
And I miss dentistry. I really loved it. But this is so much more
Well-
fun and rewarding for me.
And so, what I love about you too is you take the best of Eastern, the best of Western medicine. You are able to treat from a holistic standpoint, which is, whether it's massage or treating it, but then you also are able to help manage pain management as well, whether it's medicine or OT or PT. So, you really take the best of both and you're able to give a really well rounded care treatment plan to your patients. And I'm sure, when do they start to see results? If someone comes to you, it's not an overnight thing, is what
No,
I mean.
It's a process.
Yes.
It took years for the muscles to get that tight, unless it was an injury. If Mike Tyson hits you, you're going to
Yeah.
hit right away.
Instant,
But
right.
it takes years, and it takes months to rectify it. You're talking about East and West. I was asked to lecture at the Medical College of Beijing, China. And they asked me, would you like to see an operation after my lecture? That was a 6-hour lecture, so I made it 5.5. And acupuncture really, really works. I found this out because at the time, this was back a long time ago, I thought, well, maybe. But over there, they've been doing it for centuries. There was this little 2-year-old baby, two-day-old baby boy, kicking and screaming in so much pain. His anus was not open. It was covered by skin.
Oh, wow.
So you can imagine sometimes you get a little stuffy and it hurts.
Sure.
This kid, nothing came
Severe
out.
pain.
Oh,
Gosh, I couldn't
awful.
even imagine. So,
they threw the part away that they cut, they sutured the rest back to make it all good. No drugs, all acupuncture. That proved to me it's not a placebo, it's not voodoo,
it's
it works.
the real deal.
But over there, it's 20 years of college to become an acupuncture in the hospital
Wow.
guy.
Oh my goodness.
That's incredible.
Nobody in America is going to go to school for 20 years.
No,
years.
they're not.
Yeah.
So, how can people get a hold of you, Dr. Klein? What is your website?
TMJ Sleep, SLEEP doctor, at Michigan Head and Neck.
.com.
.com.
And what is your phone number?
586-573-0438.
Excellent. Joe, this has been amazing, hasn't
It
it?
has been very educational. Thank you.
Yeah, Dr. Klein, you're incredible, and we can't wait to have more podcasts with you because it's so much more than sleep apnea, and it's so much more than eye. You really treat the soul, to be
Like you
honest.
said, saving marriages even.
Yeah, you're saving lives, you're saving relationships, you're changing the world. And like you said too, how amazing for you what a gift to you. You went through a lot physically and mentally, but what a gift to you to give to the world. So thank you so much. Will you come back on?
I'd be pleased to. And I like to say this. I've pleased more women than any other guy in Warren
Whoa,
because
TMI.
Because
TMD,
no,
TMI.
No, when you treat sleep apnea, the snoring goes away too.
Yes.
And the women are happy about that.
I could relate to that.
Yeah, we're going to get Joe's husband, Mark, and we're going to get him assessed. So please call Dr. Klein. You have his number. You have his website. Consultation let's check it out, because he even diagnosed us and we feel so much better even in a small amount of time. So think of what he can do over your lifetime. So big thank you, Dr. Richard Klein. Big thank you to
Thank
the
you.
beautiful Joe McAllister.
Thank you.
Big thank you to our viewers and our listeners. Dr. Klein, thank you.
Thank
Truly
you.
an honor to meet you.
This has been fun.
You've been watching and listening to Innovative Health Podcast.